When I went on a routine doctor's visit, they discovered I had high cholesterol.
Hello.
Hi. The provider recommended statin therapy. I really didn't want to go on it without trying everything else first.
As a nurse, my mom really wanted to try diet and exercise. We came up with a plan and a time frame for her. And if her cholesterol was lowering, she would continue on her plan, or if it wasn't putting her at a lower risk for complications, that she would go on a statin medication.
So we tried it, and a few months later we did another blood test, and my cholesterol did not go down at all with diet and exercise. I was heartbroken that I could not control my own cholesterol with diet and exercise.
The medications decreasing the cholesterol are critical. That has to happen. Lifestyle changes, changing the way you're eating, exercising, and weight loss, those things are still important, and we still talk about those things with patients, but this pill is critical.
My mom was very fearful of going on a statin medication for side effects.
You hear the litany of side effects that might happen, so why should they take it? And then if they take it and they don't feel immediate benefit from it, they're not gonna get more energy, they're not gonna get much of anything, they're gonna feel immediately, then that's where the hesitancy comes in. So those issues need to be addressed up front. Hi, Laurie, I'm Dr. Jones, how are you doing?
I agreed to go on to the statin. We did another blood test in about 3 months, and the statin was working. My cholesterol was down. Everything was fine until COVID hit. I stopped working to care for my elderly parents, and I lost my health insurance. And at that time, I stopped taking my statin medication. When I went back to the doctors and they rechecked my cholesterol, it went right back up to the high level.
The community health center is very different, where we have a sliding scale discount fee program. It goes according to their income, and if they qualify, they would still be able to get the much needed services they need at a discounted price. She came into the center.
I understand you're here due to loss of coverage.
They were able to get her insurance. They helped direct her to a program that would help pay for her medications.
So then I went back on the statin medication, and within 3 months, my cholesterol went down 120 points to a safe level.
I will ask patients, do they know anyone who's had a heart attack or stroke, and the side effects of having that. We talk about not wanting to be one of those people that says, I wish I had. This is all about prevention.
We take heart disease very seriously. We monitor blood pressure and follow provider recommendations.
No, you did it. Look at this number, it's beautiful. I mean,
As far as taking your statin every day, you have to develop a routine. So I went to the drugstore and got a Medisets where you can put that in daily and put it somewhere where you're not going to miss it. I check my little window every day and make sure that I took the medication.
Seeing my mom's levels come down and her talking about it and understanding you're decreasing your risk of heart attack and stroke. You know, you're living longer. For me and for your grandchildren, she's very happy with her levels and her health at this time.
I realize how important the statin medication is for me to keep me in a safe level. My advice to anyone else is to know your numbers, take your medication, follow the advice of your provider so that you can choose to be healthy.